Okay, good afternoon. Today is January the 17th, 2024, and it is 1:02 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of our committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first item of business is public communication. We will receive public communication for both the Strategic Planning Committee and the Budget and Finance Committee meetings before we proceed to the Strategic Planning Committee meeting. Members of the public who wish to make comments virtually during the public communications portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments for the Strategic Planning Committee? So we have no one who has registered. Thank you. And so now we will proceed to the committee agenda. Committee Agenda 1, review and approve the minutes of the November 8th, 2023 Strategic Planning Committee meeting.
Move approval.
Thank you, Manager Valdez. Manager Valdez has approved it. Any seconds? Yes, second, Manager Martin. Okay, great. And then number 2, receive and discuss an update on the Black Men's Health Clinic. Dr. Nicholas Yagoda, Chief Medical Officer of the Community Care, will be presenting, and there will be no motion needed on this item.
Good afternoon, everyone. Thank you for having me. My name is Nick Yagoda. I'm the Chief Medical Officer at Community Care, as stated. We're grateful to be welcomed to this meeting to discuss our progress on the Black Men's Health Clinic. Could we go to the next slide? This work falls squarely in line with our strategic priorities, which mirror in many ways those of Central Health. It's surrounded by, it's based on 5 basic pillars, the center being health equity, supported by quality, community, growth and engagement, workforce well-being, and resourcefulness. This particular initiative applies most directly to those pillars of equity, quality, and community itself. Next slide, please. This is a bit of the milestone. It's an updated version of what you all saw last summer. But over the course of the last year and a half, we've progressed from what was an idea to an actual brick and mortar clinic, seeing patients at a greater and greater clip each week. So starting in second quarter of 2022, we identified the location, opening up in March. Our board of directors at Community Care recommended addition of this clinic to our scope of practice as a federally qualified health center. In the fourth quarter of that year, this board of managers approved funding to support the outreach for this community, which represents a cornerstone of the work that it undertakes, and I'll go into further detail on that in later slides. In the first quarter of 2023, we got approval to add this to scope. We've hired in the next quarter our first provider dedicated to this clinic 1 day a week, and outreach events began. In the third quarter of 2023, we expanded access to care through a modified scheduling template, which saw a progressive increase in access to care, which I'll demonstrate on a future slide. And then in the fourth quarter, this board of managers graciously allocated additional funding to support personnel, outreach, and patient navigation. And in the first quarter of this fiscal year, we transitioned from 1 to 3 days per week and added some innovative recruitment practices within our HR department to identify multiple provider candidates that will anchor a full-time operation going forward. Next slide, please. So here are a couple of key highlights from Central Health funded activities. First is the expanded operation, which I alluded to. We've been able to yield more visits for our focused population. We've increased our scope of practice to expand into the mental health range. This is complementary to what is being developed in collaboration with Integral Care. Our outreach impact has broadened to actually now enroll eligible folks in MAP, as well as participating in the coordinated assessment for housing. The funding has helped to diversify sustainability by enabling the receipt of external grants secured from St. David's Foundation, Austin Public Health, ECHO, Haag Foundation, among others. And the BMHC staff has been able to staff more than 250 outreach events. A number of them are listed, but this is just a small list of what is a fairly exhaustive line of events. Next slide, please. Clinical progress. So in the last 6 months, we have continued to increase, reaching 379 completed visits. That is much lower, I will note, than what we expect in general primary care clinics, but this is very different. And I'll go into some of those details of why this is so different and why caution in productivity is urged at the outset as we focus on building trust with a community that has been marginalized and disenfranchised for so many years. A handful of female patients have been accessing the clinic anecdotally. These are spouses and family members, partners of patients themselves. We have scripting to redirect patients to appropriate medical homes, but as is consistent with all of our clinics, we don't turn away any patients. Our primary diagnoses, which you'll see listed on the right, track with the general health profiles of men of color in the United States, leading with hypertension, diabetes, and chronic pain, all conditions that are disproportionately seen in marginalized populations. Next slide, please. Our no-show rate is improving. Our efficiency of service is improving, but it still remains high. I'll bring your attention to the yellow line. You'll see at the outset of the last 6 months, we had a no-show rate up almost as high as 50%. That has steadily decreased down to 31% because of innovative scheduling approaches and some very thoughtful approaches from our operations team. You'll see that the green bars represent completed visits. Those have steadily increased again because of how we've modified templates and access. But in particular, as noted with that dark blue arrow, we transitioned from 1 to 3 days a week of operation starting in the beginning of November. We expect those numbers to continue to climb. Next slide, please. The majority of our patients are male and are from east of I-35. So on the left-hand side, our breakout by gender. Green represents patients who identify as male. Blue are patients who identify as female. You'll see that the vast majority are hitting our focus group. And then, unsurprisingly, we are pulling patients from not only along the I-35 corridor, where you see the greatest density, but also along the eastern Travis County, that crescent being a target both of our and Central Health's equity outreach. Next slide, please. The majority, in terms of insurance status, the majority of the BMHC patients are uninsured. I'll draw your attention to the light blue and orange, which represent MAP and MAP Basic. In that stacked bar graph, you'll see those progressively increase. Of note, the self-pay comes in second or third, depending on the month. We believe there is further work that we can do to tease those out. We suspect that a number of those who are on self-pay may actually qualify for MAP or MAP Basic. Next slide, please. In terms of race and ethnicity, the majority of patients identify as Black, non-Hispanic, Latinx. That is the orange graph that is most tall on the left-hand side. But we do have a sizable portion of Hispanic, Latinx population as well. Despite the name of the clinic referencing this important key focus group, all men of color face health disparities and thus are welcome at this clinic. But we are devoted to creating a home particularly towards the particular focus group of Black men. Next slide, please. So a bit about the care model. It is threefold. The first part is establishing the brick and mortar clinic. This is to build an inclusive, culturally aligned environment housing a full scope, patient-centered medical home. At the outset, We considered whether we wanted a more mobile operation to focus on outreach efforts as well. We decided against that, instead to build a home that felt like it was a destination that our focus population would be able to feel welcome in and feel like they had a home in. So we have undertaken some work to establish that brick and mortar clinic, which is incidentally in a location that was not designed to house a clinic, but we're trying to retrofit in the most efficient manner to have it reach Joint Commission standards. The second arm of the model is a robust outreach and navigation operation. Probably most important during the early years of this work is building trust, a knowledge base, and partnership to deliver most effectively on the promise of equitable health outcomes. This is a community that has been burned for generations, and it is not going to be something that we can simply flip a switch and expect us to be able to deliver the quality of care we aspire to. So we are patient in our approach, and we are focused on that outreach most particularly, which is a rather novel approach to how we do traditional primary care, even in an FQHC setting. The last bit is that this is a team-based approach. We recognize that certainly the physician or advanced practice provider and that core teamlet remain at the center, but we wrap them around with clinical pharmacy, behavioral health, nutrition, case management, community health workers, and the like, because of the extent of the social non-medical drivers of health. We need to ensure that these patients feel adequately wrapped in their full breadth of need. Next slide, please. So objectives for this coming year. First is provider recruitment, ideally a Black male physician or advanced practice provider. We have some promising candidates. We've even made an offer a few weeks back. We're waiting on that negotiation. Secondly is establishing facilities that meet Joint Commission standards. This is a laborious process, but one that we are committed to establishing this on par with all of the excellence that we see at our other clinics. Thirdly is expansion of access. As noted in November, we moved from 1 to 3 days per week. This is an 8 to 5 operation, which may not be ideal for the focus population, or at least certain segments of that. As we build engagement with the community, further expansion of days and hours is contemplated. Outreach, as noted, remains the cornerstone, building trust and awareness. We have focused demographics and geography. Word of mouth has been activated and is bearing fruit. Much of that increase in utilization is related to word of mouth. Even some of our recruitment is related to word of mouth. So the cultural component, the connection between humans is very important to underlying success of this clinic. Engagement and navigation, we are building on the social justice principles and the social medicine principles of accompaniment, where the patients do lead through the process of achieving their health goals, and we are accompanying them through what is a very complex system that includes structural violence, bias, and various barriers that are more than one individual may be able to handle on their own. We are there as advocates as well as caretakers. And lastly, patient experience. The patient voice needs to lead the development of this particular clinic. We are building out micro-surveys so that we can, on a moment-to-moment basis, be informed by the community's needs. This is intended to be a community-informed healthcare practice. So with that, that wraps up our summary of the last 6 months of development of the Black Men's Health Clinic. I'd be happy to entertain any questions you'll have.
Yes, Manager Valdez.
Sir, I'm very hopeful and very happy with the successes that you've had. I know how difficult it is getting a startup clinic going, especially in a historically marginalized community. I was wondering whether or not maybe at the end of this year, whether or not y'all would be offering suggestions to Central Health if there are any tweaks that need to occur and how to better reach out to historically excluded populations, specifically the Black male, and maybe, since we support each other 1,000%, that would be, this would be maybe a learning experience. And is anybody doing a study out there that they can do a paper on and put it out for publishing? Thank you.
I very much appreciate those comments. Certainly, we are invested in this together, and any learnings we glean from this process would want to be broadcast so that other advocates doing similar work would be able to leverage the same knowledge base that we gain. I would, from a research and best practice perspective, there is a dearth of information out there of successful programs. There have been certain highlights that have been rather short-lived, in my opinion. Our intent is to be able to establish a long game and one that can be distributed not only to other FQHCs, but even more broadly to entities beyond just the direct primary care practice.
The reason I was looking at that is because this is a generational issue, and we want to see generational impacts.
Yeah.
Thank you.
Manager Barton.
Thank you for the work you're doing. I have a question about the diversion of patients. Primary care delivered in the context of spouses and children has been proven over and over to be important.
Yeah.
A disease doesn't just affect the man, it affects the spouse or significant other and the children. And why not just continue to, I think it's great to continue to aggressively market it to the Black men, but to incorporate allow the families to be seen and what the negative impact you would see in doing that versus a positive impact of delivering sort of complete family care to some extent.
So as a family physician, I greatly appreciate your perspective. First, all doors have to be open doors. We've had the same questions you did. And the position we've taken is at least a pilot position, and it is one that is largely driven by the community's feedback. We have already received feedback that among the focus population, when others who are not of that particular demographic are seen as part of the clinic, it starts to erode perhaps some of the original intent. Whether that is enduring or if that is just a culture we need to build of broader inclusivity while maintaining a focus on a particular group, I think that stands to be learned. But this is based on feedback we've been getting from patients themselves that there was some hesitancy to engage at the level that they might otherwise engage when seeing a exam room full of patients that look different than they do.
Right, and I'm still saying market it aggressively to the Black men who are incredibly underserved.
Yeah.
But if that instance where a spouse comes in or whatever, to sort of welcome that person in the context of the delivery of care, as you well know, as a family doctor. So I'm just saying that I would appreciate if that context was kept open to aggressively market to the Black men,
Sure.
which is needed
Sure.
dramatically, but then also to have an open point of view, as you are, I think, about sort of listening to what the community wants.
Mm-hmm.
But as you and I both know, care is better delivered in the full context.
Yeah,
So.
fully understood. And as stated before, anyone who walks in the door asking for care gets the care delivered on site. And for more of a long-term planning, we have been looking to whether there might be better fits from a location standpoint, but it is not a cut and dry issue, and we continue to keep that alive. Yeah, appreciate that comment.
Yes, Manager Jones.
Thank you very much for the work you've done. I know you've had 6 months and you've done quite a lot in 6 months, so I want to compliment you all on that.
I appreciate that. Thank you.
I concur with my colleague, Manager Martin, with regards to the inclusivity-ness of it. I also understand that when you're building something, you start with your roots and then build upon that. So my understanding is that you're going to continue to focus on the Black male, but also incorporate those in as well.
Yes.
As part of that question, though, is there a sliding fee scale for those that fall outside of the purview of our MAP program.
Oh, without question. Yeah.
And the reason I ask that is because if you look at the data in terms of public health outside of those who are just 200% of poverty, there are large number of individuals who could benefit, not necessarily from the clinical aspect, but maybe from some of the social and counseling and other kinds of services that would be unique for Black men that are not being received in the general population as a whole. So I don't know if you all have considered maybe down the road, obviously not now as you're building out, but the possibility of incorporating special focus areas for people who may not qualify based upon their income, but who could certainly qualify for some of the other services and who could pay for it through private insurance or their own way. So are you all considering that as well, I guess?
I would say that is beyond what the immediate considerations are, but certainly in the long run, this should be informed by the demands of the community. And we know that we have a relationship with the community that we believe allows us to establish a level of trust and buy-in that gains them access to services, even if, regardless of where they fall in that spectrum of income and insurance status, that is of substantial value to the public health and population health. So I would say it would be something that we would certainly be eager to explore further on down the road once we get these initial objectives obtained.
And I certainly understand that point. I would encourage you maybe to look at some of your other partners who are doing things out in the community that might be able to provide that on an ongoing basis as you develop or roll it out as well. So
I will say it's important to give a great deal of credit and respect to the work that the leadership of Black Men's Health Clinic, Mr. Larry Wallace Sr. and Dr. Larry Wallace Jr. have led in building very, very important partnerships that really build a comprehensive, integrated, and complementary suite of resources beyond just the services that community care offers. So I think as this relationship matures, as the leadership gels on a vision beyond just the short term during this initial pilot phase, or it's not a pilot, but during this initial rollout phase, we should see a lot of those aspirations come to fruition.
And finally, I say that because I have seen, and to the credit of the leadership of the clinic, a lot of visibility in the community about the clinic, and they are to be commended for the work that's been done in getting the word out.
I agree.
So thanks so very much.
Appreciate it.
That's it.
Thank you.
Any further questions? No. Thank you so much.
Thank you very much, everyone.
Yes, sir.
Well, manager said he's about to walk in the building and I think he has a question.
Okay, okay. Well,
Go ahead, he says, thank you, and give you kudos for the work that you're doing, and helping us to get back on track. We're dealing with our poverty populations.
Thank you, everyone.
I think we want you to wait just another minute. Yes.
He said you can skip him.
What's that? Oh, move on. Okay, thank you so much.
Thank you, everyone.
So again, no motion is needed on this item. Number 3, receive a 2023 year-end update on Central Health Communications. Ted Burton, Yvonne Davila, Mike Clark Madison, and Anastasia Sims will be presenting.
Hi, everybody. Ted Burton, Chief Communications Officer for Central Health. Glad to be here with you today on this very frigid afternoon. With me is some of my colleagues, Yvonne Davila, who is our Senior Marketing and Communications Director, Senior Director of Marketing and Communications, Mike Clark Madison, our PR Manager, and Anastasia Sims, our Content Manager. They are part of the Dream Team. Next slide. We're too far ahead. Anyway, part of what you here, we refer to, and some others refer to as the dream team, what I think is the best marketing and communications team in the business, with deep connections in our community, broad professional experience, and equally as important lived experience for regarding the people that we serve each and every day. Today, we are going to be providing you with an update on our communications from 2023. As a reminder, this is the communications report. Back in August, next slide, August and September, we provided to you an update on our community engagement activities and our community outreach activities. Both of those reports are in your backup materials. Next slide. Our communications department really includes 4 business units. So community engagement, community outreach, public relations, and creative services. But again, today, we're talking specifically about communication. In your report, in your backup, you have a pretty in-depth communications report from 2023. Last year, most of our marketing and communications efforts were supporting our healthcare equity plan, the 7-year plan that you adopted back in 2022. The goal of the healthcare equity plan is to develop a high-functioning safety net healthcare system that is comprehensive and, of course, accountable. And next slide, there were 4 primary objectives. Next slide. There are 4 primary objectives. So access and capacity, care coordination, member engagement, and system of care. So we're going to talk to you about how our marketing and communication efforts today support all of those objectives. With that, I'm going to turn it over to Mike Clark-Madison, who is our, I can't say new anymore, can I say relatively new, PR
Newish.
manager here at Central
Yeah.
Health, to talk to you about earned media and media relations.
All right. Thank you, managers, for the opportunity to talk. Michael. Thank you, managers, for the opportunity to talk to you today. What you see here on this slide, it's up at the top says earned media. That just means getting somebody else to tell your story for you. So we are working in partnership with members of the media all the time to shape the stories and to make stories happen that we want to happen. This is still important. I know that people think journalism is dying, might agree, but being in media gives you third-party validation, makes you more credible, makes you more authoritative. It's just good all around. So there's a lot of value to it, even though there are fewer reporters writing fewer stories about agencies like Central Health. So what you see up here on the left, analytics, the 3 metrics that we typically use for earned media are shown there for 23 and 22, and the increases that we saw in 23. A mention is being included in an individual story in an individual outlet. So if 10 outlets run the same press release, then that's 10 mentions. Impressions are the number of times those mentions were seen by audiences, so it's that number of mentions multiplied by the audience size for each of those outlets. And then AVE, add value equivalent, is how much you would have to spend if you needed to buy that many impressions for your message. So the media monitoring platform we use calculates this all for us, and you'll see that they all went up in 2023, especially the total number of mentions. And some of that, I think, reflects that there is a lot of growth actually happening on kind of the edges of digital media and niche sites that focus on healthcare, focus on government, focus on bond sales. And we are landing in a lot of those places now. So it's B2B communication, if you will, in addition to communicating with our people of Travis County or the people we serve. The graph on the right just shows how those 1,510 mentions from 2023 were spread out over the course of the year. There's a couple of highlights that I pointed out. The first hump in November, Sendero's Thanksgiving event is always a very big media generator. And then the next hump after January is the Ascension lawsuit, which sort of continues for a while, and then the hump in July is both Cameron Center and the Seton nurses going on strike, which brought our story with Ascension back to the fore. And then the peak at the top was the budget, which you may remember. So, next slide, please. So these are some of the examples of the stories that illustrate what went into that growth in the number of people learning about sexual health through earned media. On the top left, a Bloomberg reporter saw the information about the bond sale to buy Cameron Center and went down that trail and was very interested in sexual health. And so we ended up with the story there, and that's, of course, a worldwide outlet. Below that is actually my story from the Austin Chronicle when I was still there in January. I started here in April about Central Health and Ascension suing each other. On the top right,
It was a very well-written article, by the way. Very balanced, very professional.
thank you. Top right, we get a lot of pickup from the news wires that blast things out everywhere, and both English and Spanish. And so that press release about the Sendero Thanksgiving event from 2022 made its way to outlets that are really surprising. Not in a bad way, and then the lower right, this is Fox News story, and just notice that this is really just reading our press release and putting a graphic behind it, but because it's television, it reached about 10 times, maybe 20 times as many people as it would have otherwise. So how do we play it now?
Travis County Commissioners approved a $744 million budget for Central Health. It's the county's hospital district that provides health care for low-income people. The money is an 18.4 increase from the previous budget, and some of that funding will go toward health care deliveries, administration costs, contingency reserves, and the University of Texas affiliation agreement. The budget will also fund Central Health's equity plans to help close health care gaps. Other funding also includes street medicine and homeless health, as well as helping those who are incarcerated. The budget goes into effect Sunday, October 1st.
So that was good, straightforward. It's stuff that we wanted to tell. They didn't translate it entirely accurately. It's like 95% correct. But so that is how we proceed, and we're going to proceed going forward.
And I would just add that when it comes to media relations, we are probably producing approximately a press release every 2 weeks. So we are actively pushing out information, and we call it a communications cascade. The foundation is the press release. From there, everything else flows. Social media posts, information to our community, information for our website. But if you are following us, if you get our distribution of press releases and information, then you can see how much activity there is. Always in English and Spanish.
All right, so who goes next?
All right.
Next slide.
So now we're going to be talking about advertising and how, similarly to earned media, we also leverage advertising tactics to reach particular target audiences and achieve specific objectives. In fiscal year 2023, our advertising budget was $749,000, and it's important to note that this budget covered both paid media as well as creative services for multiple campaigns throughout a 12-month period. So it's a limited budget for 12 months for multiple campaigns. And just for perspective, Sendero spends more than that for one campaign for that last 1.5 months or so, just for perspective. And so as you can imagine, the result of a relatively high dollar amount of paid media spent in a short time is more high-frequency ads and possibly reaching up a broader audience as well. At Central Health, we have to be very, very intentional to maximize our limited advertising budget. We do this first by identifying specific target audiences and also where they live. And then we do this for every campaign. And so understanding who our target audience is and where they live helps us identify the right media tactics for every campaign. So we use research data to select media tactics that the majority of our target audiences use to consume information. So for every campaign, we identify a target audience, where they live, what media they consume, and what messages resonate well with them, and then also what we want them to do, right? So for example, to increase awareness of the Hornsby Bend Health and Wellness Center, which we'll talk about in detail later on today, we targeted residents living in Hornsby Bend using media tactics that they consume that they use to consume information. We didn't use TV or radio because that would be considered, in industry terms, wasteful, meaning that those are broad-reaching media tactics, and we wanted to specifically target people in Hornsby Bend. So that helps us maximize our dollars. We applied a similar approach across every campaign in fiscal year 2023. Having said that, in 2023, as you see on the screen, we enhanced our strategy and our messaging and creative assets, and all this resulted in a 55% increase in the number of clicks and a 46% increase in the number of landing page views. So we always want to send people to our website. People are very connected on their digital devices, and Anastasia will talk a bit more about that in a little bit. So all of this indicates that we had the right message, reaching the right target audience with the right media tactics. So for fiscal year 2024, we are increasing our budget slightly to $817,000, thanks to a business case that we developed and we got approval for. Again, this dollar amount will be leveraged for multiple campaigns throughout 12 months. And so you can see more details about this in your report in your packets. And next, I'll turn it over to Anastasia.
No, one more slide.
Oh, sorry. That's right. So what kind of tactics do we use for campaigns? So you'll see on the screen, we use streaming online video. So just imagine being one of our MAP members. You're on YouTube watching a board of managers meeting. Or you're watching a show on Hulu, or in a video pops up, an ad pops up. So that's streaming and online video. Streaming audio, so imagine being eligible for the health insurance marketplace and you're listening to Spotify or Pandora and an ad comes on. So that's streaming audio. Digital display, these are digital displays at gas station pumps or at metro buses or at cabs or doctor offices or pharmacies. And so we leverage those digital displays as well. We also use paid social. Radio, specifically for campaigns where we need to reach a broader audience, like I said earlier. For example, we placed ads in Spanish language radio stations and also NPR. And print, especially for campaigns where we need to reach a broader audience. Again, for example, we've placed ads in El Mundo and The Villager. You'll see on the screen some campaigns that we ran last year, connecting people to care, including promoting the upcoming Hornsby Bend Health and Wellness Center, connecting people to coverage, including promoting MAP and MAP Basic and ACA. And we also ran some campaigns connecting people to the work of the organization, and we'll talk a bit about that later on today. Now I'll turn it over to Anastasia.
All right. So, next slide, thank you. So, I don't know if you know, but 81.6% of Americans own, that's roughly 270 million people, own a smart device. If you look at the statistics on the screen, this is a more granular outlook of Travis County and specifically our patient population, that at least 87.3% have a smartphone. And if we look at the Black community, 92.8%, and Spanish-speaking, 93.2% own a smartphone. So smartphone usage is increasing across all income levels, and along with it is the consumption of social media. Social media, we know, has exploded over the last couple of decades, and it's not really showing any signs of slowing down. In fact, 7 out of 10 Americans are on social networks, at least one. So they may have a LinkedIn profile, they may be on Facebook, checking on their families, or Instagram, TikTok, at least one. So, and this is the reason why we're on social media. We're there because the potential for Central Health to reach our target audience is more accessible than ever. Who is our target audience? It's stakeholders, it's elected officials, and patients and potential patients. The next slide, this slide, you're good, thank you. This slide shows the share of adults in the United States using social networks in 2021 based on income. You can't see, but the top one is individuals making less than $30,000, and that was at 68%. And the income below that is $30,000 to $50,000 roughly, and that was 78% social media usage. And as we know, Central Health's patient population skews Spanish speaking, and according to research, Hispanic Americans are heavier users of social media. In fact, as of July 2023, about 85% of them said they were using social media. All of this means that Central Health's tactics in targeting specific populations on social and digital platforms have the potential to be very successful. We're essentially putting information in the hands of our patient population. Next slide. So we work with our marketing consultants to develop and personify our target audience. We use research and data to come up with what they may look like, what they go through in their lifestyles. For instance, meet Rosa. She is a U.S. immigrant and single mother of 2. She works part-time cleaning homes. And she really looks to her family and friends as a resource, but she goes to social media like Facebook to stay connected with her family, but prefers to be entertained on TikTok and Instagram. That's kind of like me. Next, Linda. Linda is a cautious consumer that is very information hungry. She does the best she can with her income and is very resourceful. She uses Facebook and Twitter for news, and she follows brands very closely. Next, we have Gabriel, who is a hard worker who works full-time, but his employer doesn't offer benefits. He uses social media like Facebook and Twitter to consume news, but really he relies on his wife for information. And then we have Kara. Kara is a Central Health advocate online. She's on all the platforms. She likes our stuff. She shares our stuff, and she comments. She's a big dreamer, and she has a big heart for giving back.
She's a health champion.
Next slide. Oh, go ahead. Yeah.
Excuse me. We're missing those 3 slides. We don't have them in our packet. Just to let y'all know, if
Okay.
somebody can get them to us.
Okay, we can get those 2.
It was
Okay. So our social media strategy, if you follow us, is dynamic and relative content. We want to engage with our target audience, prompting them to take specific actions, like applying for Central Health services, getting involved with Central Health, like the Health Champions program and community conversations, joining our team and applying for available careers, learning more about MAP member benefits, and ultimately visiting our website. So last year we reached 1.1 million people on Facebook, Twitter, and Instagram, and with an engagement rate of 168,000. That's 16% higher than last year. And engagement is really the measurement of likes, shares, mentions, retweets, and comments. Engagement is the bread and butter of social media. Without it, it's just media. There's nothing social about it. Social media is a two-way conversation, and through engagements, we can talk to our patient population. For instance, I fielded a message today about someone asking how they can apply for MAP and what are the phone numbers. Next slide. In addition, this is kind of the fun stuff, but we like to think our social media presence gives us personality. When you go to our channel, you can tell that we care about the community that we serve, that we're passionate about our work, and that we are a trusted source of information to find healthcare. We're going to show 2 videos. The first one is a Good Bites recipe that kind of went viral for us. It's a 3-ingredient. Good Bites is a healthy recipe channel that we have. And then the second video is the recap of the grand opening for Hornsby Bend.
We'll get you in a phone. Yeah. Start it again and unmute it if you can.
Just refresh it, yeah.
Wow. How many ingredients is this?
3. 20 grams of protein, 6 grams of fat.
Wow.
What's happening? What's happening? Hey, hey, what it does? Pick your meat, click. What's up, Bodie? What's happening? Hey, let's go. Fucking bagels.
Is it possible to have higher audio, louder?
You miss missed the viral audio,
Yeah.
but that's okay.
Yes. And there's another video.
And there's one more
Another
video.
video.
It's from our grand opening. We love showing videos, but they always kind of.
We push the
Yeah. Oh no. Oh, that should.
It's probably just a commercial.
It's.
I mean, it's very nice to have services here for my children and for myself here, closest to home and the school too.
But to kick off our event this morning, we'd like to welcome Mary Ibanez and a Zumba class, one of the many programs that will be offered here at the Hornsey Bend Health and Wellness Center.
They're short.
The house is no longer here, but with Mrs. Daly in her living room. And when I was sitting there visiting with her about purchasing this property, she had one pressing concern. She wanted to make sure that what we did here was for the benefit of the community. She didn't want us buying the property and turning around and selling it a year later. She didn't want us buying it and sitting on it for 20 years, trying to figure out what are we going to do. She was very adamant that it was for the benefit of the community and that there was something here for everybody.
This is so wonderful to have this clinic. Nearly half of counties in the state of Texas don't even have an obstetrician gynecologist. There are 35 counties in the state of Texas that don't have a single physician of any kind. Think about that. Not a physician of any kind.
We need you to embrace this. Our success is your success, and our goal at Community Care with our partners at Central Health is to strive to achieve greater health equity for all and strengthen the health and well-being of the communities we serve.
So we use those videos. We obviously took that video at the grand opening, and we took stories there. But we used clips, and we pushed that out on all of our channels like Facebook, Instagram, and all of those. And then the first one, we chose that audio because it was trending. Trending audio means you can get in front of more people. Finally, I'll just say, if you are on social media, follow us and become a Central Health ambassador for us. And that's it.
Next, we'll talk about our website. Next slide. And my colleagues are in the room. So Mike McKinnon is our Senior Communications Manager, and he's our website guru. And Camila Rodriguez is our graphic designer. They both were instrumental in helping us really relaunch an updated website this year. And hopefully you had a chance to do some exploring and you noticed the changes. But really, the biggest changes are to the navigation, how people find things, and the content. We embraced a patient-first philosophy. So we want to make sure that people who are looking for health care or health coverage can easily find it. And we have some initial analytics that show that this philosophy is working. So obviously centralhealth.net is the website. We've seen an increase in both new users, so first-time visitors to our website, and returning visitors to our website. If we had the time, we'd ask you, what do you think the most popular pages are, but I'll spare us the quiz. The most popular page is our map website, our map pages. We had more than 600,000 views and nearly 90,000 users on the map page. The second most popular is just the landing page. That just means people might have heard something, seen something, read something, and they're going to learn more about centralhealth.net. And then finally, our map in Spanish. So the map Spanish page, and sorry, I'm blocked from seeing it from here, but about 160,000 views and 26,000 people who came directly to the map page in Spanish. No surprises, kind of like media coverage, the website is also seasonal. So in September, a lot of folks are going to our website to learn more about our budget and finance. During open enrollment, people are going there to learn more about how to get enrolled in health coverage, not just MAP, but health coverage off the insurance marketplace. And this year, as we have in the last couple of years, we put Sendero front and center. We're never going to tell someone which health plan to choose. They need to make a choice that's best for themselves and their family, but making sure they knew that Sendero is Central Health owned, homegrown, and the only 4-star plan in Texas. Did I cover my?
Yeah, and also every page on the website is in Spanish.
That's right.
Yeah.
Translated by a human, not machine language.
Thank you. So next we're going to move into talking about the different strategic imperatives that are part of our healthcare equity plan, beginning with access and capacity. So next slide. This year, our communications team supported the planning and opening of the Hornsby Bend Health and Wellness Center, which opened in October, and you saw the video, and the upcoming Del Valley Health and Wellness Center, which is opening this year. The objectives, we want, wanting Travis County residents, taxpayers, and patients to be informed and excited about progress that we're making that supports the healthcare equity plan and the expansion of services, and then also increasing awareness specifically among MAP members and community care patients and potential MAP members and potential patients. We used a multimedia campaign. Again, a reminder, we've talked about community engagement and outreach in previous meetings. Today we're talking specifically about communications. So we used a multimedia campaign. This campaign, you probably didn't see it, although unless you live in the Hornsby Bend area, talking about the Hornsby Bend grand opening, because it was a very geo-targeted specific campaign for that area. The result is more than 2 million impressions, 1,500 landing page views to the Hornsby Bend Health and Wellness Center page. As you know, as we build out our website, every one of our clinics has its own landing page, and we'll follow a similar model for the Del Valley grand opening. And while we're not talking about outreach today, we did use a comprehensive approach. So everything from hanging door hangers on, I forget how many households in the Hornsby Bend area. 600. So dropping flyers off on their doorstep to the very targeted digital media, social media, et cetera. Next slide. Also, in support of our new East Austin Specialty Clinic, we work with our clinical operations team to support them as well. That will continue as we continue to expand healthcare delivery service lines in the county. But these are just some examples of signage that we created working with the team inside the clinic. You can imagine all the different signs that are required. So this is just an example of what one clinic needed for an opening last fall. Next slide. And then finally, regarding enhanced behavioral health and substance use treatment, as we did during COVID, Central Health convened a meeting or a team that included Integral Care, Travis County, the District Attorney's Office, Austin Public Health, and others to respond to the opioid crisis. So we created the Travis County Opioid Crisis Coalition with all those partners at the table. Working with our consultant, we created the campaign One Dose and It's Over, and these are some of the different collateral materials. This was also a combined media buy, so Integral Care, Austin Public Health, Travis County, and Central Health kicked in media dollars to help get the campaign out there. You probably have not seen the campaign. It is very targeted to opioid users and their network, their family, their friends. And the most important goal of this campaign was to save lives. So if somebody's is experiencing an overdose, to know that Narcan is a way to prevent death. So that was sort of phase one of this campaign, which launched last fall as well. Next slide.
All right, so next we'll talk about how our team supported the strategic imperative of around care coordination In your board packet, you have a much more detailed report. We will focus on two campaigns for the sake of this presentation. Next slide, please. So one of them is, as we do every year, we launched an initiative around MAP and MAP Basic. Wait, this is the wrong slide. Okay, so our team supported the clinical operations team on the implementation of the Epic Electronic Health Records System. And it was more around providing brand standard guidelines and direction, as well as assets to ensure that the platform was up to standards. And then number two, we also supported the clinical operations team on enhancing our communications to facilitate improved transitions of care for MAP members. So you'll see that we teamed up with our operations department to create materials that will spell out how the workflows around transitions of care, so that providers across the board will know what the procedure is and how to improve these transitions of care. Next slide. Now we'll talk about member engagement, and we'll focus on two primary initiatives that we focused on this last year. One was around MAP and MAP Basic. As we do every year, we launched a paid media campaign, and this was not just paid media. This was, as Ted mentioned earlier, our approach is a multi-media campaign. It includes earned media, paid media, grassroots outreach, etc. For the sake of this presentation, this is focused on paid media. So our objective was to increase awareness of MAP and MAP Basic among Travis County residents with low income, more specifically, those who are living at or below 200% of the federal poverty level. We were very specific in our geo target, meaning that we were specifically targeting zip codes with lower than expected enrollment per Central Health's 2022 demographic report. So if you don't live in those zip codes, chances are you didn't see those ads, okay? We wanted to be very, very, again, back to my earlier point, very specific, very mindful to maximize our paid media dollars. The dates were from July 10th, 2023 through September 24th, 2023, and you can see some of the results at the bottom of the slide. More specific details are in your report. Close to 5 million impressions and 6,600 landing page views. Next slide. As we do every year, we also ran a campaign to increase awareness of open enrollment, focusing on individuals who are a good fit for health coverage through the health insurance marketplace. Again, this was a multimedia campaign that included outreach and other methods. We wanted to focus specifically on the top 20 zip codes where 90% of our MAP members reside. And the campaign ran from November 14th through January 13th, 2023, garnering 6 million impressions and 1,600 landing page views.
And just again, a reminder that we did make sure that we were working with Sendero so that our messages were integrated and consistent. And again, not to push somebody to pick a specific health insurance plan, but making sure they knew the options, and that Sendero is a Central Health owned the only local insurance plan on the marketplace. And we also worked with HAM. Sorry? Yes, that was part of the messaging. And also working with HAM, as we do every year, we work with them on some co-branded marketing pieces. We don't have examples here today, both for paid media, social media, and also earned media relations. The next strategic imperative that the communications team supports is the system of care infrastructure. And so again, working with our direct clinical practice team, Central Health Communications developed a campaign called It's More Than a Job. I misspoke, working with our human resources department, but we created a campaign called It's More Than a Job to raise awareness about Central Health as an employer of choice. And so from this theme has a lot of different collateral materials and videos, and we're going to show a video to you in just a second, has come from that. And again, using multimedia, so everything from social media, paid media, earned media, and then also giving our HR team outreach materials to use when they're out at job fairs or meeting with other partners. So posters, flyers, brochures, etc. And I think we have a quick video to show you.
Me too.
more than a job, it's a passion. You know, the beautiful thing about nursing is that there's just so many different paths you can go throughout your career. Really what motivates me is taking care of our community, you know? Being able to walk into work and knowing that I'm making a difference and helping create an infrastructure that would increase access to, you know, specialty care and other avenues of care for our community and for our patients.
My motivation is taking care of people and making sure that the underserved and uninsured have the same opportunities as everybody else. Healthcare is a right. It should be a right for every human being.
Central Health is different than any other job that I worked before because of our patients, because of the culture that Central Health provides. Whether we're going down to march for Dr. Martin Luther King or whether Central Health is creating a celebration for patients for back to school. That's what sets them apart, is that Central Health gives back to the community and more than just the medical and mental health.
And then continuing on our marketing support for our healthcare equity implementation, operational implementation and financial sustainability plan. The goal to raise awareness about the value that Central Health brings to Travis County through our healthcare equity plan. And as always, our baseline objective is to connect people with low income to care and coverage. We have used paid media, earned media, and social media. You can see some of the results there on the screen. 1.9 million impressions, almost 22,000 clicks, meaning they've clicked through to our website to learn more information. And then some of you actually participated in our community conversation, I believe it was in July or August, about the healthcare equity plan. It was our best attended community conversation so far at the ACC campus, not far from here on the east side. And then we developed a theme that we're going to continue to use, which is healthcare is getting better. That's the message, and then we need to prove how we're doing that. One way we're doing that is through the implementation of the healthcare equity plan. Next slide.
All right, so just like we did to support the strategic imperatives, we also supported a budget priority that the board set for us for fiscal year 2023 around focused operational improvements. Starting with, next slide, supporting the evaluation and implementation of class standards. So our team leveraged a contracted national expert on health equity and language access matters and a multidisciplinary interdepartmental group. And our communication staff guided and supported this work by gathering information from internal and external resources, including patients, which we shared that with you a few months ago as well. So what came as a result of this assessment, to date, our clinical operations team has broadened the scope of our language access vendor to include video interpretation services and is hiring clinical interpreters. Also, our compliance team is developing policies and procedures following recommendations from this assessment. Next slide.
Okay, procurement. We worked with our procurement team to support the development and the implementation of the HUB program here at Central Health. Our marketing and communications recommendations were multimedia and a multi-pronged approach using both traditional and digital tactics. So for instance, there was a creation of a physical flyer that we distributed at outreach events and the stand-up banner that could be displayed at the events to like attract attention. We sent out a series of emails to a list of potential vendors, inviting them to an in-person contractor walkthrough, and then we created a few social media posts, but it wasn't really the main focus because B2B is not really that big on Facebook. We would have created a video. I know that Edwin, our video producer, this is a shameless plug for our video producer. He's amazing. We would have created a video, but that wasn't really the main tactic for this. Next slide.
And so what we've talked about so far are very specific and targeted campaigns that we develop and implement throughout the year. But we do have some that we consider to be just Central Health general awareness. under the theme of healthcare is getting better. And these are really all supporting the same goal of helping the community understand the value that the Central Health and the entire enterprise bring to the community. So unlike the other campaigns, this is really an 18-year-old and above audience. It's not specific to income or geography, but really it is, the primary audience is just all Travis County residents. And the secondary audience are people who are uninsured, underinsured, or frankly underserved, don't have access to care, or don't have a doctor. And we spent, in this general category, about $65,000. We're planning to do more with that next year, but even for this general awareness, so things like recruiting health champions, our community conversations, so candidate forums with the CEO finalists that we had a couple of months ago. We got about 1.9 million impressions, and nearly 22,000 people clicked through to learn more information about a particular topic. I'm almost done, I promise. Finally, we presented to you in December on our branding initiative, and I wanted to give you a quick update as to where we are at this point. As you can see on the screen, like the Wizard of Oz, it's come in color, so you can see a couple of the different branding options in color, full color, not just black and white like we showed you in December. A quick recap, as you know, this whole process started following the Germain Solutions Performance Review that was released in 2018. This year in September, we conducted focus groups, both with patients, non-patients, in English and Spanish. We conducted focus groups with our staff, so representatives from Sendero, Central Health, and Community Care. And with that, we came to you in December with a research-based recommendation of a logo system. And so you can see, we also added a descriptor line. So Central Health, Travis County Hospital District, Community Care Health Centers, Sendero Health Plans, and MAP, which is a program, obviously, the Medical Access Program. The top colors, they continue with Central Health's Legacy Blue and add a bright blue that really pops. And then the second option is it's blue. It isn't exactly the same as the top blue, although sometimes when people tell me that's a different shade, I'm like, it's the same. But it really is different, I promise. And then green as the secondary color. We had the opportunity to present to the Sendero board last Friday, and we really appreciate their time. They've been very involved and given us great feedback. And the board, we didn't ask their board to vote, but Juan Garza, the board chair, called for a vote, and it passed unanimously. So their board is behind this. Next, we are presenting on Tuesday to the Community Care Board. So they'll see the same presentation that you saw in December. My hope is that they are on board, and that we're really close to launching a unified branding system for this enterprise, which based on research, based on what you've told us, and based on what we hear from the community, is long overdue. With that, I know that was a lot of information. You have even more information in your backup, and Manager Valadez, we will get you a copy. I apologize if there were slides missing, but we'll get you all the complete PowerPoint presentation, but you also have a written report. Again, you have the communications report, you have the community engagement report, and you have the community outreach report. With that, we're happy to take questions. Thank you for your time.
Thank you. That was very great and fun and interesting. Yes. Did anybody have any questions? Yes, Manuel.
I do. Thank you all. That's really, really good work. Thank you so much. I did have a question about the social media. Is Central Health involved at all with X, formerly known as Twitter?
We are.
And, well, I'd like to, I want to make this very clear, so on the record, it's my opinion, not the board or anyone else's, is that we're dealing with a racist, sexist, aspiring fascist, and I don't think it speaks to our values. I understand people use it, but argue that we should not be on it.
I will tell you that we've had this conversation, and I'm sure the conversation will continue. And I hear you. And I would say the reason that we continue to use X, formerly known as Twitter, is there are stakeholders that we're trying to reach that are still very much using that platform. We don't advertise on that platform. But I hear you, and it's something that we've had a lot of conversations about, including with our former CEO, Mike Giesler, when he was here. Thank you.
Manager Valdez.
And I'm not saying the conversation's over either. I'm just telling you that it's an ongoing conversation with a lot of passionate opinions about it.
Well, my question is this, thank you for letting me speak. Can I make a motion
Sorry.
that we do not participate in X as a board?
We're not posted for action on this.
Okay,
item,
well then
sorry.
I would like for our chair to consider that, and at least Bedla, if you can let our our board president know that I'd like to have that put on as an agenda item so that it can be discussed and we can cut that conversation, make it clean, and have the board take an official position in that we are not going to continue to support any entity, regardless of what it is, that espouses values that are not ours. Thank you.
Yes, Manager Forsythe.
Thank you all for that presentation. Really, a lot of work and a lot of information, and it has significant impact. And hopefully we're reaching people where they're at. And we're talking about social media. Is there a reason we're not on Snapchat? That's missing. So there's a lot of people there. And another method, I think, what you're doing is great, and I would also want us to hone down on really traditional way of reaching individuals, because there are folks who are not on social media, are not on other platforms, who really appreciate a one-on-one conversation, meeting them where they're at their congregations, where they're meeting. So we need to have that one-on-one touch, a personal touch, to engage many our folks who we need to. So I just want to be mindful of that. Because, for instance, I'll give you an example. My family, they're not really, like, my mom is not really, so she's not really old, but still it's not reaching everyone. So I want us to really reach those who don't have access. Other than that, thank you all, and kudos to the Dream Team. Thanks.
And thank you so much. And that's why I probably am a broken record. I wanted to just emphasize today we're only talking about communications. We are deeply involved and committed to on the ground, one-on-one outreach. Those are 2 reports that you have in your backup materials. And I think perhaps in the future we just combine this presentation. We may need to triple it, but the length, so that we talk about engagement, outreach, and communications, because they all go together. They cannot work independently. It's a comprehensive approach, so it's a great point.
Thank you. I echo that, and I think in the future we need to specify what we're doing. I think it's helpful because you're all doing this day and night, and for others as board members, we're just not apprised to your work. So a good constant reminder is helpful, and it's engaging as well. Thank you.
Thank you very much. And so no motion is required on this. Oh, I'm sorry. Manager.
Thanks, Dr. Brinson. I don't much have a question, but wanted to share my appreciation. Each time when it comes this time of year, it's nice, or at any time really, I get a comprehensive update from the comms team. It's fun, and I think credit has got to go to Ted Burton and the shop that you've been running, and the team that you've brought together and who has coalesced around you, because when it comes to getting earned media that's like 10 to 20 times what your ad spend budget is, and that's if I'm halving what you're telling me the values are, right? Like, that's really, really good. And this, being in the nonprofit space, earned media that's where it's at. And to be able to do it to the degree that y'all are able to do it means that there's an in-house understanding of the incentive alignment in the media world, especially when, just the pushes and pulls there as organizations are downsizing, as reporters and actual journalists are being maybe treated differently in the marketplace, and the labor incentive changes. And I think understanding what talent to develop in-house, what talent to bring in-house, and how to match that balance of the muscle we may need to hire out of the house to work with that and constantly strike that balance and achieve our goals on a really reasonable budget through the lens of, I think, very, very inclusive diversity, I should add, is really impressive. And, I think we owe all of your team, all of y'all, a debt of gratitude for the consistent work that y'all do. That's often thankless. Like, we don't complain when the air conditioner works. We complain when it goes out, right? So when we know that the message is going out and our content is good and our comms strategies are sound, we're not going to complain. I'm like, oh yeah, they're doing their thing. We'll complain whenever we want something different done. And so just thanks for that. I mean, we produce our own in-house content, and I think y'all have seen it on social media with ads, but these videos, it's really fun, and I think it's a real privilege. So thanks for that. And with respect to the notion around the head of the formerly known as Twitter organization and our engagement around that, I just wanted to respectfully suggest that perhaps we leave the recommendations on staying in and out of a market tool to the experts on staff, and that we maybe express our opinions here. And if there were to be a resolution, it might just be around our preference, first of all, our opinion of a certain person or persons, and whether or not that person's shared expressions are in line with our mission or not. And secondly, that we might suggest or make a recommendation that our staff look into perhaps diversifying where our efforts are going, because clearly we're not doing ad spends there, right? But diversifying what our channels are when it comes to that particular type of communications, e.g., make sure that we're putting an equal or greater effort into aspiring platforms like Threads or like Blue Sky or something like that, so that we're making sure that we are contributing to the other market, I guess, if you will. But anyway, those are just some thoughts I have. Thank you, Dr. Benson. Thank you all.
Thank you. I wanted to say thank you very much for your kind words. And again, I want to emphasize, it's not me, it's the team. And I've had a chance to work with several communications team over the years, and these people are the best. And we were fortunate to hire them, and we're able to retain them because of the amazing work that they do and the support that you give the team. It's really important to have the support from our leadership that believe in communications and marketing. So, and other folks in the room, I introduced Camila Isela Guerra is the head of our outreach, and that's the whole. And you're going to hear from Yesenia in just a second. So, they're amazing, and I meant it when I said they're the top of their profession, with lived experience, professional experience, and a deep and genuine, authentic passion for the work that we do and care for the people that we serve. Regarding social media platforms, I think it could be helpful if we could provide a memo to you, because we've had these conversations and there are a lot of pros and cons, and I don't want to just say we'll do this, we won't do this. We're looking at Threads. Yeah. We have used Snapchat. We don't just kind of make it up because one is the trend of the day or one might be going away. So if you would allow us to provide you with even just a memo specifically on X, Twitter, because I guarantee you there are people on this team that are as passionate, if not more, about some of the things that you've said. And I think that could be helpful for all of us.
That makes a lot of sense. And I think I probably went too far in my mind with the recommendation on diversifying markets or channels that we use. But you were right. I think that memo would be just great for my perspective.
Yes, and Manager Martin.
I just have one comment, really. I would agree with Manager Motwani that we need to follow y'all's suggestions and your guidance. It's not our job. Y'all do this professionally, whatnot. It was simply a matter. I think I would value an opinion about our direction about that. Because it's not just him, it's that organization that's large. So, okay, thank you so much.
Thank you.
And my comment to all of this, just in closure, and then we can move on. is that I didn't remember us ever having a conversation at the board level about this. And so that's the only reason I'm bringing this. Maybe staff has had conversations, but I do not remember it as at the board level where we had this. And so the only reason I wanted us to put it on the agenda is to make sure we did at least have this. Thank you very much.
Thank you very much.
Manager,
Oh, I'm sorry.
I
Manager
would just like to concur with my colleagues and commend you on the great job you've done. Certainly awareness and is very critical, and so I'd like to support you there. As one of the few baby boomers who are here on the board, I would though encourage, and I think you're going to talk a little bit about the outreach part, the balancing of it for those who are over a certain age who are not as engaged in the technology, who are somewhat left out, or it's not intentional, but from their perspective, they don't get in on it. So to the degree we can address those as efficiently as we do the new technology, I think it's good.
And I think next time, just having presented today, I think we should next time present engagement outreach and communications all together. And again, we would need more time, but I think it'd be helpful to see how they work together, because I don't expect you to remember a presentation from August or September. I can't even remember the presentation from August, September. So I think it'd be helpful if we did it all together. I think it would be more efficient. So point taken. Thank you. Okay. We have
Thank
one
you
more
all very much.
presentation. This one will
Yes.
be pretty quick.
Yes. And then.
We're next, I think.
Yes, you're next. Our next presentation is to receive an update on the Central Health Latino Family Support Conference, and Ted Burton, Ivan Davila, and Yesenia Ramos will be presenting, because we love to hear from you guys.
Pull up the slide. Okay. So next on the agenda is to talk about the Central Texas Latino Family Support Conference. Again, with me is my colleague Ivan Davila, our Senior Director of Marketing Communications, and Yesenia Ramos, who is our Community Engagement Supervisor. A quick history. In September, Manager Valadez championed the Central Health Board of Managers in adopting an amendment to our FY24 budget to the tune of $125,000 to plan, this year is a planning year, a Latino Family Support Conference. The exact language is here on the screen that you defined. You defined the conference as an event serving bilingual, Latino, and other non-English speaking Travis County residents, focusing on mental health needs and healthcare disparities, and modeled after a similar event for African American families that's been held in Austin for more than 2 decades. That is a conference that we participate in and we regularly table at, so we're there promoting MAP and MAP Basic at that conference. And with that, I'll turn it over to Yvonne.
Thank you, Ted. So we took the different components of the language straight from the amendment, the board's amendment to the FY 2024 budget, as overarching guidance. And for example, it said that the event is to serve bilingual, Latino, and other non-English speaking Travis County residents. And we took this, and again, we want to use that as overarching guidance. And we looked at the demographic report, Central Health 2022 demographic report, to have a conversation around ethnicity. So per the 2024 demographic report, in areas of low income in Travis County, the Latino population is a dominant ethnicity, representing 60.2% in high and moderate poverty census tracts. Also, comparatively, 34.2% of Travis County's overall population is Latino as of 2022. You'll see on the screen the breakup or the breakdown of Latino, the ethnicity breakdown, both on the combined focus areas as well as Travis County as a whole. Just as a reminder, the focus areas outlined in the demographic report include Colony Park, Del Valle, East Central Austin, North Central Austin, North Travis County, Northeast Austin, Oak Hill, South Austin, and Southeast Austin. This is all on our website, and it's in the demographic report that was shared with you last year. Next slide, please. Going back to the overarching message from the board, the amendment to the FY 2024 budget around language. Again, the event is to serve bilingual, Latino, and other non-English speaking Travis County residents, and we wanted to define what that could mean. So we went to the 2024 demographic report, and we saw that in areas of high and moderate levels of poverty, English and Spanish are the primary language of almost equal percentages of residents, 47.1% and 46.4% respectively. Comparatively, across all Travis County, English is the predominant spoken language. When we look at other languages, other than English and Spanish, the most widely spoken language in high and moderate poverty areas in 2022 was Vietnamese. Next slide. So, around content. Now going back to the amendment. The amendment said that the event was to focus on mental health needs and healthcare disparities. Let's go back to language real quick. We believe that the conference should be 100% bilingual, Spanish and in English, again looking at the data, making simultaneous interpretation services available in Vietnamese and other languages. I'll go back to look at the data for that as well. And then in terms of content, since the amendment said that we would focus on mental health needs and healthcare disparities, staff proposed that health disparity data of Central Health's Latino MAP enrollees guide the content of the conference. For example, among Central Health's MAP enrollees, Latinos are most impacted by these long-term conditions: heart disease, high blood pressure, mental health and substance use disorders, and diabetes. So we plan to make Spanish the primary language for presentations and breakout sessions with interpretation options in English for one day, for example, and then another day would be in Spanish, interpreted into later down the day, in Spanish, interpreted into English. Again, with interpretation services available in Vietnamese and other languages. The intent of the event is not to exclude anyone, but to be inclusive, even though the primary focus will be placed on the Latino population. Next slide, please. So in terms of the event objective, we want to address the unique health challenges faced by Latinos living at or below 200% of the federal poverty level in Travis County by doing it in two ways. Destigmatizing chronic illness and mental health conditions, and two, providing valuable information, resources, and support to manage and prevent chronic mental and physical health conditions. Sonia?
And we've been working with our staff, our data analytics, our strategy, and our clinical operations on defining ways to track 4 desired outcomes. Our 4 desired outcomes are improved health literacy, which means increasing awareness and understanding of chronic disease prevention and management, leading to improved health outcomes. Enhance community networks, strengthen community bonds, and support systems, fostering a sense of belonging and mutual assistance. Increasing access to care, enable better access to healthier services by bridging gaps and addressing barriers. And cultural sensitivity, cultivating a culturally sensitive environment, better connecting patients and healthcare providers. Next slide, please. Our next steps include 4 of these over here outlined. Staff will form a planning work group and community advisory committee to further develop and refine the concept of the Latino Family Support Conference. These groups will be tasked with outlining specific details such as the event logistics, potential speakers, and collaboration with community partners. If you'd like us to explore including community members in this advisory committee, please send your recommendations to Brianna and she'll forward those to our team. The staff will continue updating our board of managers through the event planning process, leaning on the expertise of Manager Valadez, Manager Martin, and Manager Zamora. And our timeline for this, our planning will take place in fiscal year 2024, and our execution will take place in fiscal year 2025. And that is the end of this presentation. Any questions?
Yes, Manager Jones.
Hip-hop communications, I say that in the sense of language. We're going to talk about those who, I'm being facetious, so that we are generational in terms of our communication, whether it's in Spanish and in other languages as well.
Correct.
That's very important to get the message out.
Yeah.
Yep.
So it'll be English and Spanish with interpretation services.
In other languages.
In other languages, yeah. Is that, okay.
Those who are part of the cultural sensitivity in each language, that approach is a lot different, so I'll just encourage that be incorporated as well.
Sure. Okay. Thank you.
Yes, Manager Valdez.
Yes, Shannon, I completely agree with what you're saying, and I think that what we're trying to make sure is, or facilitate, is ongoing expansion into our unrealized population that has not yet come into the Central Health fold and is not receiving services from Community Care or any of our partners. And another thing is to make sure that we understand at Central Health that there may be a need to look at making sure just that we have staff that is appropriately represented of all the cultures that we serve, and that they are able to communicate with those patients in their own language, as opposed to constantly relying on interpreters, telephone conversations, video calls, or whatever. So that's what we hope to achieve.
Thank you. Any other questions or comments? No. Thank you all very much.
Thank you very much.
Yes, thank you very much.
Appreciate your time.
Thank you.
All right. And our number 5, review tentative reporting schedules for fiscal year 2024. Managers, there will be no presentation on this item, but there is material in your backup, and staff are available to you for questions. No motion is needed on this item. So lastly, our last thing, confirm the next Strategic Planning Committee meeting date, time, and location. Our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, February the 7th, 2024 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. And at this time, I am ready to accept a motion for adjournment. Yes, Manager Valadez moves and Manager Martin seconds. Thank you all very much. Shall we take a little break? Little break, or?
So 5-minute break.
5-minute break.
So there's food in the next room.
Brianna.
to make sure that my goal is to have us all out by 3:30. We need one more. There are two. Can you get them? There are two in the eating. I can? Okay. We took public communication. Okay, perfect. Okay, are we ready? Okay, perfect. Thank you. Good afternoon. Today is January 17th, 2024, and it is 2:43 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Do we have anyone? We do not have anyone on our online. We will proceed with the Budget and Finance Committee agenda as we took on public communication early on. Agenda item number 1. Approve the minutes of the December 13th, 2023 Budget and Finance Committee meeting. I move that the committee approve the minutes of the December 13th, 2023 Budget and Finance Committee. All in favor?
Do we have a second?
Oh, so do we need a second? So Manager Bell does. Second. Any discussion? No?
Any nays?
Any, all in favor? The motion moves. Second item, receive a presentation of the Central Health Fiscal Year 2023 Financial Audit. Jeff Canoto will be presenting with representatives from our outside auditors, Maxwell, Locke, and Ritter. Good afternoon and welcome.
Thank you. Both of them? Oh, okay, thanks. I'll eventually get it. Thank you, Jeff Canoto, Chief Financial Officer, and with me is Jimmy Rommel, the partner for Maxwell, Locke and Ritter, who is the external audit firm that Central Health utilizes for its annual financial audit. We're here today. I'm actually going to turn it over to Jimmy. He's going to go through the draft financial statements. We're not asking for any action at this meeting. We'll be back at the board meeting next week to request acceptance of the report. So with that, I'll turn it over to Jimmy for his presentation.
Thanks, Jeff. Good afternoon, everyone. So as Jeff mentioned, we'll be going through the contents of the draft financial statements, which are going to be in the various slides we'll be discussing today. I'll be going through these. Obviously, if you have questions as I'm going through each slide, feel free to reach out. Otherwise, we can definitely field questions at the end of the presentation. So this first slide just gives you an overview of what will ultimately be included in the final audit report. Nothing in here is new except for there's a couple new things that are going to be included in this year's audit report because a single audit or a grant audit was required for fiscal year 23. So in previous years, we've had your financial statements, we've had your auditor's report, your management's discussion and analysis. We've always done the audit under government auditing standards, so there's always been a report related to that. But what will be added this year is we'll actually have a report for compliance for your federal program that was tested as part of the single audit this year, and then a separate schedule that will list out the total expenditures incurred related to the grant, and then just some notes behind that, as well as a summary of findings and question costs. So we'll just kind of give an overview of all of the information that's included in the audit report. So as I noted, so when you get the final report, you'll definitely see a few new pages from what you've previously seen in prior years. And then as a reminder on the financials, on the actual statement net position and statement activities, just like in previous years, you'll have the information included for your three component units, being Sendera, Community Care, and the CCC. Next slide, please. So we are going to be issuing a unmodified or clean opinion, which is the highest level of assurance that we can provide as your external auditor. And this is on the financial statements. Next slide, please. And as I mentioned, as part of the audit, we do review key processes and internal controls, because under government auditing standards, we're required to ultimately report on whether or not we note any material weaknesses in internal controls over financial reporting. And what this slide is indicating is that we are not going to report any material weaknesses. We did not identify any material weaknesses in internal control over financial reporting. And then also, there's some compliance items we're required to look at as well under government auditing standards. And we noted no instances of non-compliance for that report. So even though it's not an opinion or assurance on internal controls or compliance under government auditing standards, it's basically the cleanest report you can get that we can provide to the board. Next slide, please. So as I mentioned this year, and I don't recall a single audit being done in quite some time for Central Health, but this year a single audit was required. And just as a reminder, anytime you incur grant expenditures in excess of $750,000, that's what triggers a grant or single audit requirement. So the one program that you received funding under was the COVID-19 Disaster Grants Public Assistance Program, and it was about $2.2 million of expenditures that were incurred under those awards. And so there were actually 5 separate awards that were granted, and those were all granted during fiscal year 23, but the majority of the underlying expenditures that those grants essentially are reimbursing were incurred from March 2020 through July of 2022, and then a very small portion of that was actually from July 22 to February of 23. And all those were flowed through the Texas Department, or Division of Emergency Management, or TDEM, was the subrecipient that came to y'all. So just pointing out that, like I said, this is new. So as I mentioned at the front, you'll have some additional information in your report in relation to that. We are going to be issuing an unmodified or clean opinion on compliance under that major federal program. And then also we noted no material weaknesses in internal control over compliance for the major federal program. Next slide, please. So in addition to the audit reports, we also are required to communicate formally to the governing body at the end of the audit. This kind of referred to normally as a governance letter. So normally what's included in here is if there's any significant changes in accounting standards, which as you can see, there was one new accounting policy, which I'll discuss here in a little bit, that was implemented. So that will be included in that formal governance communication letter to the board. We had no difficulties in performing the audit, had no significant audit adjustments through our audit process, and also had no disagreements with management as part of our overall audit process. So we definitely want to thank everyone here at Central Health for all their assistance this year in getting the audit completed. Next slide. So this will be your statement of net position and showing both your fiscal year 23 results as well as your fiscal year 22 results. So just to note for fiscal year 23, if you recall last year for fiscal year 22, there was a new accounting standard related to leases, and it impacted both if you're on the lessor side and the lessee side. And it required, if you're on the lessor side, to include a receivable for future payments you're going to receive with an offsetting deferred revenue balance for future revenues that you're going to basically record on your financial statements. And then for the lessee side, you reflected a long-term liability for future payments where you're the lessee making those payments, and then you have a corresponding what's called a right-of-use asset because you don't own it, but you're leasing it, so it still shows up as a capital asset on your financial statements. So for fiscal year 23, GASB statement number 96 was implemented, and it has a very similar implementation to the lease standard that was implemented last year. But what it focuses on is long-term subscription-based IT arrangements. So a good example is if you say you're entering into an agreement to use a software from a third-party vendor, you don't own the software, but the agreement is longer than 12 months, then that falls under the scope of this standard. So, but the recording of the standard is very similar to the lease standard in that you record a right to use the underlying software and then a corresponding liability for the future payments you're going to be making on that agreement. So really, just like with the lease standard, the actual net impact to your net position number is very minimal because you're bringing on an asset, you're bringing on a liability, and they don't exactly cancel each other out, but there's not usually a whole lot of difference between the asset balance and the liability. And the liability gets paid down, and then the asset essentially depreciates or amortizes like you would for a typical capital asset. So just want to point out that now GASB 87, which was last year, definitely brought on a lot more assets and liabilities. So if you were to look at fiscal year 22 compared to fiscal year 21, there was a big jump in assets and liabilities related to that. The implementation of GASB statement number 96 for IT arrangements didn't have as big of a jump in your assets and liabilities, but there was, once again, so in theory, you're not technically comparing apples to apples when you're looking at 23 and 22, but the overall impact was not nearly as significant as it was last year when the lease standard was implemented. So kind of looking through your balances for fiscal year 23, you'll see overall assets, were about 1.2 million of total assets. The biggest change overall was, your investment balances increased year over year. On the liability side, the majority of the increase in liabilities was related to the 2 certificates of obligations that were issued. You issued about $100 million of certificates of obligation during fiscal year 23. And then to arrive at your bottom, or your ending net position number of about $719 million as of the end of fiscal year 23. Next slide, please. So this will show your revenues and expenses year over year. And you can see overall, increases in total operating revenues as well as total operating expenses. The one new line you'll see is the UT affiliation payment. That was the amount that Central Health paid during fiscal year 23. In previous years, that was fully paid by the CCC. So this is picking up that difference that was paid during fiscal year 23. And then for your non-operating revenues, really no significant changes in the categories there. Investment income, that increased primarily due to interest rates overall have obviously gone up. So and of course your investment balances have gone up as well. So that would make sense for your investment income to increase as well. But then overall, a change in net position of about $128.6 million during fiscal year 23. Next slide, please. So other financial highlights, as I mentioned, GASB 96 has been implemented, so just want to point that out. So as of the end of the year, there was about $4.7 million roughly of capital assets related to the subscription-based IT arrangement agreements and about $4.6 million of related payables. So as I mentioned, you can see there's really not a whole lot of net impact to your bottom net position number in relation to that. And then also, as I mentioned, you issued $99.4 million of certificates of obligation during fiscal year 23. Next slide. So a couple other things. All your accounts are properly collateralized under FDIC insurance. As part of our audit every year, we do review compliance under the Public Funds Investment Act, and we noted no instances of non-compliance under the PFIA. And then overall, your certificate of obligation and general obligation bond balance was about $173.1 million as of September 30th, 2023. Of that amount, about $7.4 million of principal is due in fiscal year 24. And with that, I'll open up to any questions you may have for me.
Thank you so much for that presentation. Appreciate it. I also want to extend my gratitude and thanks to the Central Health staff and to Jeff Kanoda and your team. Thank you for an outstanding, clean audit. We really appreciate your hard work. Really, on behalf of the entire Central Health Board, we thank you for your hard work. Thank you so much.
Sheriff, I could just.
Yes, please.
I get the easy job of just sitting up here, but it really is the finance accounting staff, Patty Bethke and her group that does all the work. So thank you for the acknowledgement, but her Patty and her accounting team do all the hard work related to audit. So
Thank you, Patty, and to your team. Please extend our appreciation and gratitude on our behalf. Thank you all. With that, as you mentioned earlier, this item is only informational item. Next week we will act. So if you have any questions, you can ask them today, or you can ask them next week. Manager Valdez.
Thank you. So I noticed here on this
What page?
revenues and expenses sheet. I don't know that these are, if it's numbered, maybe it is 8. Could it be 8? 7? No, that part of the report doesn't have numbers on the page numbers. But anyway, what I'm asking basically is, where does the contingency reserve and emergency reserve numbers go? Where do they go? I see them on the financial statements that are submitted in the next component, the next segment, but on this sheet, I don't see them. Do they not belong anywhere?
So that's, I'm assuming you mean like just future reserves for
Contingency and emergency reserves
So on
that
this,
are there, but are sometimes used.
right, so if they're used, they would actually fall under the specific line item that the expense relates to.
If we don't have a line item budget, then it's just thrown in there somewhere?
Well, yeah, because these are just high-level summary groupings.
No, I
They're-
get it.
They're not going to be at the budget level, but from a budget perspective, and I guess Jeff can probably speak to that more than I can.
Yeah,
So the reason I ask that is because that has been an issue of concern with the public, and I would like to know where they're to be located here.
So let me start out. There are two different types of presentations. This is a accounting presentation, which is different than our budget presentation. Now,
Yes.
there's a lot of similarities, but from a budget perspective, we have our reserves that we show from a budgetary standpoint. So that's where you'll find the information. You won't find the reserves in this accounting presentation. That's not what's considered generally accepted accounting standards and accounting reports. So that's where we track it, and we do have some information in the next presentation around that, and we'll certainly continue to report that per your request.
I appreciate that, Jeff. I just didn't realize that the contingency reserves and the emergency reserves were not part of an accounting report. I did not know that. So thank you for, this is the first time I've heard that.
Well, it's a complicated answer from the accounting side of it, because there's a unrestricted assets line item here, but that encompasses a lot more. You could say that what you're asking on the reserves are a subset of that number, but the actual, and I don't want to get too technical, and I'll be more than happy to walk through this at a subsequent meeting if there's a desire, but the ending balances are really more calculated on a working capital basis, which is a little bit different than the unrestricted net assets that you see here. So I'll leave it at that, but what I will tell you is that we will show that information in subsequent budget sources and uses presentations.
I appreciate that. It's just that the last time you made a report, I asked specifically about whether or not that what was that unrestricted amount?
Right.
And I wish you would have just told me then that includes some of the contingency reserves amounts. Is that what I'm understanding?
Yeah, it's
Just to be clear.
It's going to include a whole lot of things.
I understand.
Basically, everything that's not restricted. And again, the reserve balance calculations are substantially different than what's called unrestricted assets on these statements.
I understand. Thank you
Thank you.
for making it clear today.
Thank you, Manager. Any further questions? I see none. With that, thank you so much for your presentation, and look forward to seeing you next week. Thank you.
Thank you.
Now, moving on to agenda item number 3, receive a presentation on the preliminary November 2023 financial statements for Central Health. Jeff Knodel and Patty Betke will be presenting. Welcome.
Thank you. So this will be a quick presentation of the Central Health interim monthly financials as of November. We have been focused on completing our external audit. So what you'll see in this report is we haven't had enough time to do the full analysis that we typically do, which includes a lot of accruals. So it's somewhat abbreviated, but we think that the balance sheet represents our financial position, and we've done some major accruals on the sources and uses schedule. We just haven't gone into all the specific lines. I don't know if y'all remember all the different specialty care lines and all that. So that's been a challenge given both the holidays and the limitation of time that we've had and completing the external audit. So thanks for bearing with us in that. We'll come back at the next budget finance meeting with the December report, and it'll be a lot more comprehensive and a lot more complete than this report is currently. So just kind of, I'm sorry. No worries. Okay, thank you. So just kind of walking through some of the highlights real quickly. Our healthcare delivery expense is $24 million as of 11/30. Our net assets are $123 million. And then our LPPF balance is $5 million. And I think Mr. Rom will talk some about GASB 96 being implemented, which is another part of the financial statement process that we'll need to start going through. But again, not as material as it's as the lease, the GASB, what's known as GASB 87 has been. Next slide. So just real quickly on the balance sheet, total current assets of $989 million, which primarily consist of cash and cash equivalents and short-term investments. Long-term assets of $112 million. You see our capital assets, total assets of $1.5 billion. We had current liabilities of $349 million, which a lot of that is the deferred tax revenue line item, which means that we're at the very beginning of our property tax season. And so technically the property tax levy isn't due until July 31st. And so there's both a receivable that you see on the asset side and a offsetting deferral on the other side of it related to that tax levy. Funds held by the LPPF of a little over $5 million, and then our debt service payable long-term amount. And you see some of the related items around GASB 87 for total liabilities of almost $812 million. And then our total net assets of almost $702 million, which total liabilities and assets are again at $1.5 billion. Next slide. And so this is our only other slide that we're going to present. It's a really high-level sources and uses presentation. But again, as you see on the property tax revenue, technically that's not due, so very little collections on that. The other thing to note would be on other revenue, interest rates related to our investments continue to be much higher than they have been in previous periods. It's probably fair to say that we will exceed our FY24 budget of $7.5 million. In 2 months, we've collected almost $4 million, so we're already at 52.7% of that budget. The tobacco settlement revenue, we typically don't receive that until April, so that's at 0. And then, as I mentioned, on the healthcare delivery program, we are at $24.7 million, which is about 8.4% of the spend. I would just note that if you look at at fiscal year '23, just for comparative purposes, we had about a $23 million capital transfer that we don't have in fiscal year '24. So just from an apples to apples perspective, you want to take that into account also. And then you see administration is running a little bit higher this year. We're at 10.5% of our budget. And then our approved budget also had about an $8 million increase to our emergency reserve. And so you see that year to date of $8 million that is transferred over. It increases our emergency reserve by $8 million. And then certainly last but not least, Manager Valdez, I just want to point out that there is some limited reserve balance information at the bottom. So you can see on the emergency reserve that we've increased from fiscal year '23 to fiscal year '24. That's the $8 million that you see up above that increases that balance. And then the contingency reserve for fiscal year '24, we've budgeted an ending balance of $377 million. Once we complete the audit for fiscal year '23, we'll come back and give you the final ending balance as it relates to fiscal year '23 that rolls into '24. So that's our limited presentation. Thanks for your indulgence on there's just too many, what's the saying, too many irons in the fire at this point. So we will be back next month for a much fuller report.
Thank you, appreciate it. Is it a quick question, Ms. Manager Valdez?
Do you have another presentation? I'll just wait until you finish it.
The
Nope,
reason-
this is it.
I just, for everyone's, because I'm gonna lose a member, so we need to be done with our meeting by
My
3:30.
very quick question.
So
then
that's
will
just
be,
wanted to make it.
I've heard a lot about HAM, but I haven't heard anything about Sims recently. And I'd like to know, is there something going on? I saw that Sims was hiring a new executive director or a CEO, and I just didn't know, are we still funding them in any way or not?
Yeah.
What are they doing for us?
I'm just going to speak generally because I
Yes,
don't.
sir.
Can we discuss this?
I'm sorry?
Can we discuss
Part
this
of the
item?
budget.
Yeah, I think so.
Oh, okay, just wanna make sure, thank you.
Yeah, so,
thank you.
so what we're talking about is part of the ACA.
Excuse me?
I said, thank you for bringing that up. Yeah, but it's part of the budget. I thought I heard you ask.
Okay, we'll continue on, Mr. Jeff.
Yeah. I'll make it really quick. So.
Thank you.
So, it's part of the ACA subsidy program related around Sendero. And so I don't know what the difference is on leadership between Ham and Sims, but what I can tell you is that overall, I'm just going to call it the Ham/Sims membership, I believe has increased slightly. So there's nothing that's changed as far as the program. Now, I don't know there are any changes in leadership or what the difference is around both of the entities. I'll have to have someone else answer that in another forum.
I appreciate that. If we could get that response maybe by the meeting. But I do remember that it was Sims that used to actually do a lot of the outreach, not necessarily Ham. And now I hear a lot about Ham because they're working. I know that they have the contract that I supported with Sendero, but I didn't hear anything about Sims after that.
Okay, so you'll
just
keep
curious
that
about that.
information.
Just for clarification purposes. Gracias, Perla. Thank you, Jeff.
Thank you.
Does that conclude your presentation?
Yes.
Thank you so much.
Thank
And
you.
do we have any further questions for any board members? I don't see any. Thank you, appreciate you all. See you next month. Now, moving on to agenda item number 4 and 5, receive and discuss an update on Sendero Health Plans. Sharon Albus will be presenting on that item. And for agenda item number 5, is receive and discuss contractual issues and the status of the Central Health third-party administrator for patient claims processing. For that item, Jeff Canotto, John Morgan, and Sharon Albus will be presenting. At this time, I announce
Recording stopped.
I announce the committee is convening in closed session to discuss agenda items 4 and 5 under Texas Government Code 551.085, Governing Board of Certain Providers of Healthcare Services, and Texas Government Code 551.071, consultation with attorney. It is January 17th, and it's 3:12 p.m. Thank you. So we'll just wait a couple minutes to get situated and we'll move on. Members, today, what do I have? So we discussed item 4 and 5, and there are no action behind those two items. Now, moving on to item number 6, confirm.
Sorry, you have to do the date and time.
Oh, I'm
again.
sorry. Have to do it multiple times. So today is January 17th, 2024, and it is 3:37 p.m. And we're in closed session. We just left that, and we are now in open. And we discussed item number 4 and number 5, and there were no motion necessary for those two items. Now, moving on to our final agenda item, item number 6, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, February 21st, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas 78702. At this time, I'm ready to accept a motion for adjournment.
I
Manager Matwani, seconds. All in favor?
Aye.
Aye. A motion passes. We are adjourned. Thank you, members.